Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
This podcast is supported by Progressive, a leader in RV insurance. RVs are for sharing adventures with family, friends, and even your pets. So if you bring your cats and dogs along for the ride, you'll want Progressive RV insurance. They protect your cats and dogs like family by offering up to $1,000 in optional coverage for vet bills in case of an RV accident, making it a great companion for the responsible pet owner who loves to travel. See Progressive's other benefits and more when you quote RV insurance at Progressive.com today. Progressive Casualty Insurance Company and Affiliates. Pet injury is an additional coverage and subject to policy terms.
ABC Wednesday.
I'm Joan, and I'm your first Golden Bachelorette.
Joan's getting a second chance.
This is about everybody like me, navigating, trying to find love at this age.
I wouldn't be here if I didn't have hope.
Because love never ages.
Golden age doesn't mean you're old. Old is a state of mind, like a lot of living to do.
The Golden Bachelorette. Series premiere Wednesday on ABC and stream on Hulu.
Hearken to thine inner voice and give thyself a bell. No task shalt be denied if thy will be strong and true. For when a bell is rung, it carries with it the sound of courage, that giveth strength to even the meekest of hearts. So ring thine own bell, and be mindful of its power and might, for 'twill be thy guide in whatever task thou setst thy sight.
Lord and Lady Douchebag! You see? Your stupid minds. Stupid!
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios in beautiful downtown Bedabbler City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. Gives me street cred with the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who never listen to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and the stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. So don't forget stuff.drsteve.com. That's stuff.drsteve.com for all of your Amazon needs. It really helps a lot. And you can go there and scroll down and see the Rhodey tuner, and you can get it for your person. What's the date on this one going to be?
Going to be 16
of
December.
Of December?
Yeah, 23.
Okay. All right. And so no, it won't. Now it won't be for the podcast though. Yeah, this is going to be after the holiday. So hey, it's after the holidays. You didn't get what you wanted. Go to Rhodey.drsteve.com and get yourself a Rhodey tuner if you got a guitar or a mandolin or a bass for the holidays, or if you got an instrument, a stringed instrument, you don't know how to play it. Go to Rhodey.drsteve.com and they have the Rhodey coach there. It'll teach you how to play the damn thing. It's amazing. And then tweakedaudio.com. I actually checked the link. It actually works still. 33% off. I've never seen a discount like that anywhere.
That's great.
So you buy 3 things, you pay for 2 of them. And go to Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And patreon.com/weirdmedicine. I've been doing live streams there, just kind of getting the kinks out. And those are going to get cranked up and will be much more excellent as I've got a new live stream studio that is working now, but it needs to be optimized, and I'm working on that. And then if you want me to say fluid to your mama, say thanks for all the wonderful holiday gifts that you got, go to cameo.com/@weirdmedicine. No, sorry, that's not correct. Cameo.com/weirdmedicine. That's cameo.com/weirdmedicine. It's cheap, and I'll take them on a tour of the studio if you want, whatever you want. All right?
Sounds good.
Okay, thanks. So check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And he'll send you some dopey, weird medicine tchotchkes.
Yes.
Somebody posted on Twitter all the crap that you've sent him over the years.
I'm good.
So
I'm all about sharing.
One of them he had for so long that the ink had faded on the... It was funny. So anyway, yeah, check that out at simplyherbals.net. All right. Tacey is not here. She's on sabbatical. P.A. Lydia is on sabbatical. DJ Mel B is on sabbatical. DNP Carissa, I think, is probably, I don't know if she's ever coming back. She's got
we've moved to the bottom of her list of importance.
She has a new relationship, and so we don't
count anymore.
We don't hear from her much anymore. But if she wants to come back, she's always welcome. She's always fun to have in here.
Well, it's kind of like what John Prine says about songwriting. He goes, you only write songs when you're miserable. Who wants to write a song when you're happy?
That's right. Yeah.
So she's obviously happy, and she's got something to do with it.
Yeah, good.
Be miserable with you and I.
Yeah, right. Good for both of them. I've been there before.
You're formerly happy, aren't we?
I was happy once. So I get it.
Formerly.
Anyway, yeah, you get all involved in your own thing. You just don't think about anybody else. That's fine. So anyway, the thing I liked about her on here is I'd say, okay, you got anything to comment about that? And she's not a radio person or an improv person, where you're supposed to yes and everything. And she'd just go, no. And just leave me hanging. It was funny.
She's the queen of one-word answers.
Yeah.
It was either no or rude.
Yeah, rude.
Rude.
So anyway, maybe she'll come back before she moves away.
There you go.
All right. We do not have Tacey's time of topics today, so we're going to have to improvise here, Dr. Scott.
We're going to wing it. I like it.
So we have a couple of questions, so let's get this going first.
Number one thing, don't take advice from some asshole on the radio.
And we've got a couple of recent ones, and then I thought we would go back to 2015.
Oh, cool.
And answer some questions we never answered.
Another time travel episode.
Yep. All right, here we go. Let's see here.
Dr. Steve, Dr. Scott.
Hello.
Howdy.
Hey, and Fluid family.
Hello.
Hey, I'm going to show my ignorance here. I've been playing these trivia
what
games.
Do you mean this time you're going to do that?
Games on Instagram, about 6 questions in a block. And it said that a newborn baby is born with approximately 300 bones. And then I Googled that and got the same answer, but adults have 206.
Right.
Where did the other 94 bones go?
All right. So this is actually a very good question. I'm going to give
thyself a bell.
Great question.
We'll give the listener a bell on that one. Yes, indeed, babies are born with approximately 300 bones. And if you consider the skull bone to be a single bone, well, then you know the answer, because babies with an intact skull cannot force themselves through the vaginal canal. When they have bones in their skull that are already fused, it's called craniosynostosis, and those babies very often, if they are able to be born vaginally at all, tear their mother all to all to pieces, and there's a lot of reconstruction has to be done. So those are separate bones.
Right.
Babies have the soft spot. You've heard of the fontanelle.
The fontanelle.
And but you don't have one of those. You have a soft spot in your heart.
I am a softie, as a general rule.
But you don't have a soft head.
No. I've got a hard head, evidently.
Right, and you have a flaccid, other parts of your body.
Wrong parts hard, wrong parts soft.
Right. Yeah, I got a hard head and a soft something jungle region. But anyway, so those things all fuse. And so when you look at all the bones that are separate, that are allowing for growth,
Right.
And then the cartilage that binds them together becomes bone eventually. And because otherwise bone would not lengthen. You need growth plates to do that. And the skull has to be, like I said, malleable to get through the birth canal. So once all of those things fuse together, those 300 bones become 206. And that's the answer. So
great question.
Very good question.
Right out of the box.
Yep. Here you go.
Steve, it's Dave.
Hey, Dave.
Hey, Dave.
Quick question. I know you're a parent.
You know my parents?
I'm 6 months into my first kid. What reason?
He knows that we are parents.
Parents.
Thought he was doxing me.
I'm 6 months into my first kid. What resources or where did you look to keep up with developmental milestones? I see a bunch of different stuff.
Well, I had textbooks, but I can tell you where to look. Yeah.
But I always trust your opinion and would kind of like to know the list you're comfortable with, things like that.
Yeah. So what he's asking about is how do you know your kid is developing normally? And I have textbooks. I had training on that, what you would see at 3 months and 6 months and all those kinds of things.
Right.
And that's actually on my board exam. But I'm going to give you two resources. Go to drsteve.com, click on the upper right hand, the three dots in the upper right hand corner, and then click on one-page baby manual.
Yes.
It has care for the baby, but also talks a little bit about developmental milestones. But what you're really interested in is what's normal for your infant.
Okay.
So I like Mayo Clinic. That's a good one. If you just click or Google Mayo Clinic newborn milestones, you'll find a page that says healthy lifestyle, infant and toddler health. And then you've got infant development, birth to 3 months, and what to expect. Newborns' movements are jerky at first. There's a couple of weird reflexes where if you take the kid and you lay them down real quickly, their arms and legs will jerk almost like they're having a little seizure. But that's a normal reflex. And then they'll over time. I remember when Liam was 5 months. That was the first time that he pushed up and could look at us over a bumper on the bed. Before that, he was completely immobile.
Wow.
They just kind of, and they're just laying there. And we took him to Arizona on a trip, and we got a crib that had the bumpers in it. They're about 6, 8 inches high. And we were just laying in bed, and we woke up, and there was Liam looking at us over the bumper. And that was like, whoa, he had never done that before.
How funny.
Yeah, it's funny.
That's cool.
So anyway, Mayo Clinic is a good one. Cleveland Clinic, any of those sort of, the American Academy of Pediatrics, American Academy of Family Physicians, they all have these sort of milestone charts in them, and they're fine. Don't just get some rando website other than mine. Because you don't know what they're saying.
And a lot of those reputable websites are going to have a very similar things.
It'll be all the same stuff. Yeah. So any of those are okay. I would like to do a goof website where you say, your kid should be speaking in sentences by 6 months, and everybody that looks at it will think their kid is dumb. So anyway, all right, okay. So those are the recent ones. Let's go back to June of 2015 and see what this is about. I listened to a show I listened to them to make sure the audio's okay and all that stuff. And there was one where we said, let's listen to this person from 2015. And they were talking about going to the emergency room.
Should I go to the emergency room?
Right.
I'm having
like, hope you're okay, buddy. It was 8 years later.
Yep.
All right, here we go.
Yes, I'm on venlafaxine for anxiety, and I
Yep.
heard you mention an anxiety medicine today, and I was just curious what the name of that was.
Oh,
I
boy.
really do not like venlafaxine. If I forget to take it, I get dizzy, and then I don't recover for the rest of the day.
Yeah, so venlafaxine is an SNRI type drug, a selective serotonin norepinephrine reuptake inhibitor, and it's used for depression but also for anxiety. And you may remember that when I had chronic abdominal pain, for some reason, never did quite figure out what was going on, my doctor put me on Cymbalta. And after about 6 weeks, I said, this stuff didn't do anything, and I just quit it. Mm-hmm. Don't do that.
Yeah, don't do that.
That was stupid. I didn't know at the time that, this is long enough ago, that with a relatively new drug, that there's a withdrawal syndrome. Mm. And I had brain zaps, and I had Terminator eyes. Talked about that. Yeah. Where, if you see the Terminator when it's in its robot form and you hear the servos moving, which why wouldn't you hear that when it's covered in fake skin? But anyway, and when its eyes would move, you'd hear zook, 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 with these servos moving, right?
Okay.
And that's what I would hear. When my eyes would move, I would hear the servos behind my eyes making noise.
Gosh.
It was crazy. It lasted about 2 weeks.
Oh, wow.
So don't stop that stuff on its own, on your own. Now, there are lots of things for anxiety. Mm-hmm. The reason they put you on venlafaxine is because it is not habit forming. I mean, there is a withdrawal syndrome if you stop it, but it doesn't cause craving of the drug and all that. And there are other ones like that are not habit forming. There's one called hydroxyzine, which is basically an anticholinergic drug like Benadryl. I'm not a big fan of taking those every day, 3 times a day, 4 times a day for the rest of your life because they increase your risk of dementia down the road. Mm-hmm. So then there is buspirone or Buspar. Some people get really good results for their anxiety.
Okay.
From that. I tried taking it because I had bad anxiety, and it just caused a serotonin rush or something. I would be sitting at my desk at work, and I would get this rush, like I was getting high, but I never actually got high. And I was not a fan of that one.
Right.
So, and there's non-pharmacologic stuff,
yes, of course.
too. So you want to talk a little bit about some of the non-pharmacologic stuff?
Yeah, I was going to say a couple things. On the more Western side or allopathic side, and we've talked about it before on the show, but some doctors will actually do a stellate ganglion block. So they'll actually take a little needle and put a little diabetic kind of size.
We got to learn how to do that.
Yeah, and it's not a simple procedure, but it's a quick procedure. And somebody that's skilled hands and has done a bunch of them can do it, within about a minute. That's about how long it takes. And all they do is they just squirt a little numbing agent over this ganglion, and it helps to calm you down a little bit. And it works. And they use it a lot for the military.
Bundle of nerves.
Yeah. And they use it for a lot in the military, but they're also using it, a lot outside the military now. Now other things would be things like, meditation, breathing apps. We've talked a lot about the. What's the Oculus? They've got the meditation apps that you can actually.
I love the Oculus Trip app, TRIPP.
Right. Yeah.
If you have an Oculus, you can do a free trial and just check it out. They only give you access to the focus module, but you can still get an idea of what it's like. Mm-hmm. And that's notorious for decreasing anxiety. Mm-hmm. Partially because they do breathing exercises.
Right.
So I had the worst anxiety I've ever seen in anybody I had. You know, everybody, thinks yours is the worst. But I was almost agoraphobic in the sense that every time I would go out of my house, my anxiety would ramp up. And I've told this story before, so I won't go into it. But I cured my anxiety through challenge.
Yes.
I continued to challenge it. And the very last challenge was something that would have normally terrified me, which was being trapped in a crowd of about 10,000 people, shoulder to shoulder, and it couldn't get out. And it was either get better or die, and my brain decided to get better. But the problem with agoraphobia is people get anxious, they get a panic attack, let's say when they're driving on the interstate. So they don't drive on the interstate anymore. And then they get a panic attack going to the grocery store, so they don't go to the grocery store anymore. And then the post office, and then it gets to where they're confined to the locale around their house, and then now that causes anxiety. If they get anxiety going out to get the mail, then they don't go out of the house anymore. And now you are what you are classified as agoraphobic at that point, when they just are too anxious to leave the house. And the thing is that the anxiety, all it does is make you uncomfortable. It doesn't actually do anything to you. And when you realize that and you challenge it, your body eventually learns that it's not going to kill you and it will go away. I no longer have panic syndrome. I had it so bad I thought about checking myself into a loony bin.
Yes.
And I
think
I don't think that's the proper term, but you know what I mean. But
yes,
that's how bad it was.
Yes.
It's hard for people to believe. I had it so bad that if I had a good day, I knew a really, really bad day was coming. And every time I would walk down the street, I would see all these people laughing and talking and stuff. I was like, you guys are fools. You don't realize there are murderers amongst us. There are criminals. That illusion of safety that you have is nothing but an illusion. Now, am I cured of my anxiety? Yes, I don't have that physical adrenaline, hypervigilant fear reaction anymore. But I was doing EMDR with my shrink. And I only tell this story because other people may relate to it. And EMDR is this eye movement thing where what they learned is when you're in REM sleep, you are processing information, right?
Okay,
and
right.
your eyes are moving back and forth and back and forth. Well, you can wag the dog by moving your eyes back and forth, and then it will force your brain into a information processing mode.
Okay.
So when you do that, one of the things that my shrink does is she does this type of EMDR, and you have to come up with these Jungian Carl Jung archetypes.
Okay.
And you had to come up with one for wisdom, and mine for wisdom was Alan Watts.
Okay.
And then you have to have a safe space to go to, and that's my dad's lake. I felt safe there, and it was peaceful. And then you had to come up with an archetype for compassion, and only a few people get this, but it was Andrew Wiggin from Speaker for the Dead. It was a book by Orson Scott Card. It was a sequel to Ender's Game. And but she said, come up with an archetype for protection. I couldn't come up with one. And it was weird. It was like when I went to my doctor with my neuropathy, he said, walk a straight line, and I couldn't do it. I had no idea I couldn't do that. And I had no concept of an image of somebody that would protect me, I learned to play the piano at the end of a high-heeled shoe, and, my sister would push my niece down, apparently. This is what I'm learning now, and then blame it on me.
Oh, no.
And so, she was another adult in my life. My brother tried to protect me from some hoodlums because I was mouthing off to them. And he came out and they went away. But then that night they grabbed me outside my house and kidnapped me.
Oh, gosh.
Yeah. And, they just wanted to just scare the shit out of me. They didn't, want to kill me. But It was terrifying.
Sure.
For months after that, I laid in bed, I couldn't sleep, and I just I made up sermons thinking that somehow that would help, and at least it took my mind off of things. So I have no images of protection in my head whatsoever. So, I'm going to have to work on that. But anyway, where were we going with this? Oh, the anxiety. Yeah. So it lingers. Yeah. There's still, I didn't realize I had that problem until she brought it up. And we talked about that. So that was part of my anxiety is someone was breaking into my house. I caught them. And there was they weren't startled and ran away. They just sat there with this cold look and looked at me and just went, yeah, man, like that, and just would very slowly turn around and walked out. And that just freaked me the F out.
I think we're learning a lot more about what's going on inside that brain now.
Oh, yeah. Well, no shit. Yeah, no, I'm fucked up. But I don't have anxiety anymore. I'm not agoraphobic. I almost became that, but there was something within me that said, no, you got to go to work every day.
Okay.
And you got to go to the lab, and you're still going to medical school, and, you can't stop doing things. And by challenging it in that way, I eventually overcame it. So there are, cognitive behavioral therapy is a way, if you take it seriously, a non-pharmacologic way to ameliorate your anxiety. That's where we were going. This guy was talking about the venlafaxine. And then the very last resort are the addictive drugs, and they are habit-forming.
Well, I was
addictive, like the benzodiazepines. Go ahead.
Well, I was going to say, before you get to those, there are a number of other things that real quick, though.
Oh, yeah, of course.
Things like sensory deprivation tanks. You know, acupuncture actually helps with anxiety because it stimulates the serotonin in your body.
Well, and you also deprive them of sensation when you're doing it. Other acupuncturists do it that way, too. I know you do it.
Not all.
You turn the lights down and you have the spa music
mine's a very
and the aromatherapy
zen
and all that
space,
stuff.
Yeah, I like to just keep it calm because I'm so wild. It keeps me calm.
It was a very calming experience when I did it at your place.
Yeah, and I try to keep it like that all the time, especially when people don't feel so well. Exercise is another
stimulates
great thing,
endorphins.
Great way to work on anxiety. And I both have had this, lived with it, dealt with it. And work through it every single day to a certain degree. And then you get, but then like you said, the last resorts, and you think about.
That's what I'm saying. I'm just saying that as a last resort.
Things
they work too well.
Yeah,
and people end up on them and they can't get off of them.
Right.
And then when they don't take it, the lack of the drug stimulates their anxiety response, so they need it again.
Yeah.
So I really, I think those are great if you've had a severe loss or if you've had a traumatic event to get you through a little bit.
Yes,
or,
I agree.
I'm fine writing somebody alprazolam, which is Xanax, to get on the plane if they have issues. And like Tacey took 20 milligrams of Valium before our wedding. She was stoned out of her gourd. But I do look. There's some people that need them chronically, and they can't live without it. But I would absolutely go there as a last resort.
Yes. You reminded me of a quick story. They were telling about Jerry Garcia one day was getting ready to go out and play, and I guess was having some anxiety, and the guy handed him was going to give him a Valium, and he just grabbed all of them, put them in his mouth, and choked him down, and Steve Parrish, who has a show on Sirius XM, was saying that he was eyes were getting heavy, and he's about to go to sleep, and they're like, "Hurry, go get all the truck drivers and get all the cocaine they've got."
Oh, Jesus.
So poor thing, they coked him up to offset the benzos, and went out, and I guess during the second said, I guess he kind of came back to,
sounds like
good old Grateful Dead Jerry Garcia.
Have you ever heard the, I don't know if I can find this quickly because I wasn't planning on it, the Elvis when he was drunk or
stoned or
something?
Whatever, I don't think so.
It's quite humorous.
And I love me some Elvis.
Sure. I mean, who doesn't, for God's sake? Now, did you know that Elvis in Viva Las Vegas did Liszt's Lebenstraum.
No, I did not.
Yeah, one of the songs in there was completely lifted from Franz Liszt.
Huh.
And Eric Carmen's All By Myself, which was on my list of wimpiest songs.
Oh, God, yes.
It is actually Rachmaninoff's second piano concerto.
Really?
The theme from the second movement, yeah.
Oh, my gosh.
Yeah.
So funny.
So, they came after him.
Oh, yeah,
because
good.
It's public domain in this country, but not public domain in Russia. And his family is still in Russia, even though Rachmaninoff emigrated to the United States after the Bolshevik Revolution. And his family came after Eric Carmen, and he had to give him 12% of the royalties. And if you go look at it, Sergei Rachmaninoff has a writing credit on that song.
Oh, okay.
Because it's just taken straight from it.
Oh.
All right, here's Elvis drunk on stage, supposedly, allegedly.
I wonder if you're lonesome tonight. You know, someone said the world's a stage and each of us play a part.
Oh, goodness.
Plus tax. Read your lines select cleverly. You never missed a cue. They came back too. They forgot the words. They would change, you fool. You acted strange, and why, I've never known. Why ever did it?
Oh, gosh.
Honey, who am I talking to? You lied when you said you love me.
Who am I talking to?
Oh, my gosh.
I have no cause to doubt you. But I really go on hearing your lies. And go on living without you.
There you go. Anyway.
Oh, my goodness.
So it's still, he was still the king. I would have killed to seen that.
Oh, my word.
Yeah, so I wonder if there's any video of Jerry Garcia out there on Valium and cocaine.
Yeah.
Oh, it's every video.
Yeah.
Every Grateful Dead video.
I think it's a significant portion of it.
I'm just kidding. I don't know.
No.
All right. No. Well, very good. Okay. I hope his anxiety's better 8 years later.
Yep.
All right. Let's see here.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Hey, Dr. Steve. Good morning. My name is Steve. I'm calling from Wayne, New Jersey.
Hey, man.
I'm calling regarding blood in my urine, or speckles of blood, little crystallized in my urine and in my semen.
Okay.
I get lower right abdominal pain. I've been to the ER. I've been to my primary. Nobody knows what's going on. Sometimes it seems worse after a night of drinking.
After what? Did you get that? No.
At the games.
Yeah, it's then he crapped out. Yeah, so blood in the urine and the semen would have to be a common pathway because urine comes from the bladder, Semen comes from the seminal vesicles and the prostate and the vas deferens.
Yeah, okay.
And then, but all of these come through the urethra, so you're almost going to assume that he's got some sort of urethritis, an infection in the common pathway.
Yeah, maybe some prostatitis.
But go see when you have problems like that. You can go to your primary care. That's great. But if they don't dope it out immediately, you've got to see a urologist.
He said he had pain in his lower right.
Yeah, and it could be a kidney stone lodged in there too. Yeah. That's possible. So. Yep. But anyway, so urology.
Yes.
Penis equals urology.
Yes.
Okay.
Yes. Go there.
All right.
Good luck.
So, yeah. Hopefully you got that taken care of.
Hey, Dr. Steve. Hey, I had a back injury, and subsequently I'm on a couple medicines, Erectile, buprenorphine, Cymbalta. Hey, anyway, my question is when I start working, I sweat. And when I say sweat, I mean I will drench 4 or 5 T-shirts within 5-6 hours. I mean, you can wring these things out. What do you think is wrong? Thank you.
Okay. Do you well, it sounds like he's implying that it's due to the medication.
Yeah, that's kind of what I was thinking too.
So, what did he say he was on? Cymbalta?
Yes, he was on a couple. Cymbalta.
Was he on morphine as well?
Or buprenorphine? Did he say
buprenorphine?
I thought.
Okay.
I don't think he's on morphine. Yeah, but
well,
of course that would explain it too.
I think that the duloxetine is the culprit. Increased sweating is an effect of the SNRI type drugs. And it's not dangerous, but it can be bothersome. You can use an antidepressant, but maybe just get off that drug and onto something else. They're using it for the neuropathic pain from your bad back, and there are other things that they can give you, including gabapentin. Or you could see a physiatrist.
Yep.
People think they hear the term physical medicine and rehab, they think they're going to like a program. That's a medical subspecialty. They have the same problem that palliative medicine does. That's why we don't call it palliative care, because palliative care is what they deliver.
Okay.
It's not what they are.
Gotcha.
And palliative medicine still doesn't sound like there's still confusion about that.
Okay.
Pain management, that kind of says what they are, but palliative medicine doesn't say what they are. And so eleology has been proposed, because if you go to a cardiologist, there's no question what you're doing. You're going to someone that studies the heart.
Right.
If you go to a pulmonologist, you're going to someone that studies the lungs. A dermatologist, someone who studies the skin. And then you go to a physical medicine and rehab, and it's like, okay, is this like, am I going to a nursing home? Right?
Right.
No, that's a subspecialty.
Yep.
And they can do some really cool stuff.
Yes.
They can do facet joint injections. The reason I can walk today, and I can even run, and I can hike and all that stuff, is because of a physiatrist or a physical medicine rehab. They're synonymous. And they put me on this table. They got a C-arm, which is an X-ray machine that can swivel around an axis, and they will swivel that thing around until all the holes line up that they're looking for, and then they know exactly where to put the needle. And they inject you with steroids or some other medication, and you can see it go in. And within a day or two, I'm walking again.
Yeah.
I'm not crawling up the stairs in abject pain. And, it's amazing. So I highly recommend anyone with chronic low back pain go see a physical medicine and rehab person, particularly one that wants to treat pain. And you will have a much better chance of getting a non-pharmacologic, non-chronic opioid type therapy out of it. I've never taken the first opioid, and if I showed people my back, they would say, "How the hell are you even walking?"
Well, yeah, and that's what I was going to add to that story, is that you would have been like probably a surgical case.
I was going to be.
You know what I mean?
I changed my mind.
Yeah, had you not tried the physical medicine, so that
True.
was a wonderful thing. And surgery is wonderful if that's what you have to have.
Right.
But certainly we want to try to keep people from surgery.
But good Lord, if you have a failed back surgery, and that's the percentage is pretty high, having the second surgery is even lower. So if it's like 50% of people have a failed back, then another 50 on top of that, so 75, I don't know the exact numbers, will have a failed back the second time, and then it's like 80 and then 95. And the more back surgeries you have, the less likely it is that you're going to have a good outcome.
Exactly the same numbers as divorce. Divorce in America.
Well, shit.
50% get divorced.
No, I'm with
the
you.
second time.
Yeah, fuck off. All right.
Oh, well, yeah, we've
But I think that's what
been
that
there,
is.
done it.
I think that's what that is.
Yeah, I think so too.
All right. Let's see. Let's try this one. Oh, shit. I'm calling them. No, wait. No, don't do that.
No. They'll be like, who?
Oops. Wait a minute. Okay, there we go.
Hi, Dr. Steve. I'm 50 years old, and I'm taking
Okay, he's now 58 years old. So.
citralopram, Celexa for anxiety.
Oh, wow.
And it gives me raging erections all day long,
Really?
but I'm having problems ejaculating.
Yes.
It takes forever.
Yeah.
And I was wondering if there's anything I could take to kind of counteract that, because the citralopram keeps me level, and I like it.
Okay, well, now this is one that likes the citalopram, but now he's having another problem, which is delayed ejaculation. So people have a delayed ejaculation with the SSRIs. That's a common sexual side effect. There are a couple of things that you can do. One is you could try taking a non-drowsy antihistamine 30 minutes before you have intercourse. That would be like loratadine, which is Claritin, or famotidine, which is not famotidine. Is it famotidine?
I think it is.
Oh, famotidine is Allegra.
Yeah, Allegra.
Okay. Why am I thinking?
I think that's right.
Wait a minute. No, it's fexofenadine. Famotidine is Pepsid. So fexofenadine.
Okay, I'm sorry.
The reason they have similar suffixes is because famotidine is an H2 histamine blocker, whereas fexofenadine is an H1 blocker. Well, anyway, so fexofenadine is Allegra and loratadine, Claritin. You could try one of those 30 minutes before. Those very often will reverse the sexual side effects of these drugs. If that doesn't work, your prescriber could co-prescribe bupropion. Bupropion works by a different method, and it's supposed to also sort of cancel out the sexual side effects of citalopram. And if nothing else works, you could switch to an SNRI, which have fewer adverse effects like that.
Gotcha.
Again, duloxetine would be the normal one, or venlafaxine.
Gotcha.
Okay.
Gotcha. Good.
All right. I've got the hiccups. That's just great on a radio show.
No.
Hello, Mr. Weird Medicine. My name is John. I'm calling from Poughkeepsie, New York.
All right.
I
Hey, John.
heard an episode of your show many moons ago, and it was considered RSD, which I've been diagnosed with, and it's very painful and it sucks. And I was wondering if science has gotten a little better and how they can pinpoint where nerves are being crushed or damaged to the point where it's causing this. And it's something that I would be really interested in getting some more information on if you have it. I appreciate it. Thank you. Bye.
Okay. Well, I wish. He's talking about reflex sympathetic dystrophy. They don't really call it that anymore. It's now called complex regional pain syndrome. And you got type 1 and type 2. You got anything for him on that? Because there's really nothing new. I have it. They took a toenail of mine off, and I got complex regional pain syndrome from that.
Yeah. A couple, well, yeah.
It's topical, and mine is localized, so I can put anesthetic compounded cream on there. You can get lidocaine, you can get gabapentin, you can get ketoprofen in these creams from a compounding pharmacy. They can even add ketamine to it if they need to just get a little bit of boost, and it does help with the pain. But go ahead.
Well, yeah, and again, if it's a nerve root being pinched in the spine, sometimes you have to have a surgical procedure to reduce that. But that's not
Correct.
typically.
That's not really what CRPS.
That's not typically what we see is that we usually it's a sequel of an injury to the nerves. So what we do in pain medicine and acupuncture both, especially interventional pain medicine anyway, sometimes we'll actually put, and it sounds crazy, but putting the needles in the area where the RSD is, and electrical stimulation will actually stimulate the nerve pathways and shuts everything down. It's called the fatigued gated channel.
That makes sense. Yeah,
and it gives the body a chance to reset. And it's the hardest discussion I have with anyone is when they have CRPS RSD, because they want to know if I'm going to make them worse by putting a needle in them first.
Sure.
And that's the most challenging. And I have to tell them, no guarantees, but as a general
I wouldn't think
rule,
it would make it worse.
It shouldn't. No, but and believe it or not, you can actually get little teeny acupuncture needles, and people with RSD way easier than you can, in a lot of other folks. It's very because it's different.
Well, I have
than
numbness along with mine.
Yeah, but it's different than a hyperalgesia, like somebody's got a systemic nerve pain that, from taking chronic opiates or something like that. But so we actually do. You can actually get a lot of relief from doing other things. Hyper-stimulating. A lot of times they'll send you to physical therapy, and let's just say you've got in your hand your whole hand.
Put a vibrator on it,
they'll
or
put
something.
They'll do a vibrator, or they'll make you punch rice and punch and punch and punch until you can't punch it anymore.
Wow.
And that overstimulating sometimes will correct that RSD.
Well, isn't that interesting?
Yeah.
Okay.
Yes, you actually have to overstimulate. And one of the worst
Give
things.
thyself a bell.
Hey, cool.
Yeah.
Thank you.
Well, you taught me something.
Yeah. And
teach me something, you get a bell.
one of the more challenging things and worst things that someone can do is use opiates long term for CRPS.
Yeah,
it just doesn't really help.
Yeah, so the symptoms: continuous burning or throbbing pain, usually arm, leg, hand, or foot. Sensitivity to touch or cold, swelling, changes in skin temperature, alternating between sweaty and cold, changes in skin color from white and blotchy to red or blue. Skin texture may become tender, thin, or shiny. Changes in hair and nail growth. So all of this sounds like circulation stuff, which is all related to the sympathetic nerves going nuts.
Yep.
Joint stiffness, swelling, muscle spasms, and tremors. I have all of that in my foot. Now, the type 1 is reflex sympathetic dystrophy. This occurs after an illness or injury that didn't directly damage the nerves in the affected limb. About 90% of people have that. And I have type 2. It's also called causalgia, which makes sense. It's causing it. Their symptoms are the same, but it occurs after a distinctive nerve injury.
Right.
So most cases occur after a forceful trauma to an arm or a leg, and you can get muscle wasting and atrophy and contracture and all that stuff. If you have a wrist fracture, taking vitamin C might prevent CRPS from occurring. And if you have a stroke, early mobilization will fix it as well.
And it's sometimes casts that are too tight or improperly put on can lead to it.
Sure.
And Dr. Steve, too.
That would be causalgia because they'd be actually damaging them.
Yeah. And we'll actually see it sometimes. It appears there may be a bit of a genetic predisposition. You sometimes see it run in families.
Yeah.
Yeah, which is
well.
tough,
remember Maya?
Rudolph.
The case. No, Maya Rudolph. She's awesome.
Yes,
but the case, about the kid with.
Oh yeah, I'm sorry. Yeah,
they had CRPS. I'm looking at Mayo Clinic, and they recommend intravenous ketamine. Studies show low doses of intravenous ketamine may substantially alleviate pain. So there you go.
Yeah.
There are other medications that you can use. Prazosin, which is known as Minipress, clonidine, corticosteroids might help. Bone loss medications, antidepressants, there's a lot of stuff you can do. You got to go to somebody who knows what the hell they're doing, and they're not blowing you off as a chronic pain patient.
And Dr. Steve,
they need to listen to you and treat you appropriately.
And a lot of docs have never seen it.
Yeah,
they really haven't. That's why it's important.
Right. Many are called, but few actually have it. Same thing with fibromyalgia.
Right.
Many people are called fibromyalgia, but are really probably something else.
Yeah.
All right.
Low testosterone.
Yeah, maybe. Here we go.
Hey, Dr. Steve. Matt from Canada. I was just calling to ask you what you think about Sylvester Stallone's documented GH use and what you think about growth hormone use for anti-aging.
Okay, so growth hormone has been demonstrated to improve healing and trauma in older folks. Okay. Other than that, if you don't watch out, you're going to end up like the butler on the Jeffersons. He had a tumor that was causing excess bone growth. Jaws from the Bond movies had this as well.
Oh.
It's called acromegaly.
Acromegaly.
And it can cause pain in the joints, swelling of the joints, swelling of the jaw. Because what you're doing is if you overdose on this stuff, you're actually telling the bones to grow, but they can't grow anymore. So they do the best they can because you don't have growth plates anymore. And this should be done under a physician or a licensed provider's direction, and only for specific indications till we know more. Listen, I'm all about anti-aging. I take phosphatidylserine and I take true Niagen, which is the nicotinamide riboside, and I take some other things like that, citrus bioflavonoids. And, I'm not quite as bad as Ray Kurzweil. He takes like 200 supplements a day because he wants to live long enough to get to see the singularity happen where we merge, human minds with machine minds. And it must be driving him crazy right now because we're tantalizingly close with these AI models, but still very far away.
And the new quantum computers.
Yes, that too.
Goodness sakes.
That's what that show Devs was about, that had Ron Swanson in it, which actually was very good, was about quantum computing and trying to recreate reality within a quantum computer. But anyway, so there's that. So I'm not against in any way anti-aging stuff. I just want good data on it. Or knowing that there's not going to be harm. And that's the problem with, citrus bioflavonoids or phosphatidylserine. They're known to be safe, whereas I'm not 100% sure that the HGH is perfectly safe when taken for anti-aging. So I'm waiting for the data on that one. I have an open mind. All right. Let's see.
Hi, good afternoon.
Hey, good.
I was wondering if you could explain the difference between doctor's titles between an MD and a DO. Thank you.
Yeah, sure. Question is, can we tell the difference between an MD and a DO? They're the same thing. They have the same curriculum. They can do all the same things. There's no restrictions on DOs. Matter of fact, when I was in Michigan, all of my doctors there were DOs. They were very common. They're called doctors of osteopathic medicine. They do go to separate medical schools, and they have another curriculum where they learn osteopathic manipulation. Now, most of the DOs that I know learn all that stuff, and then they never manipulate again. They do it. They learn it, and they sock it away, and so that they know the anatomy and all that stuff. But then they go do a fellowship, and then they do OBGYN or whatever. But I had the first DO in Upper East Tennessee, where we are, was one of my professors. And at first, they were, back then, DOs weren't as accepted as they are now.
Yes.
And, they just were alien. But this guy was amazing. He was really good, and he did manipulation. So if a woman had horrible back pain because of the amount of the hormone relaxin that opens up the pelvis so that they can pass this baby through. Before the baby's born, this hormone is secreted and they start to loosen up their pelvic bones, and that can cause pain. He had a really good manipulation that he would do.
Yep.
Yep. And so he was still doing osteopathic manipulation. I encourage our osteopath friends to do that.
Do it, yes.
Because they've got some really cool
got some
techniques.
skills.
Yeah.
They just have to have time to do it. That's the problem.
That's right. And in
a
this
clinic
age
situation.
of EMR and 15-minute visits that really should be 30-minute visits, et cetera, it's very difficult
Very
to
challenging.
do. All right. Okay. Well, we've got we have a little bit of time, so we're okay.
Yeah, I was calling in. I was told to see a pulmonary specialist.
Yeah.
Basically, I have a choke in my throat, and I have a cough, and I'm on the phone all day at work.
Yeah, I can relate.
They put a nebulizer, an inhaler, and then Tussionex, and my
Tussionex is a hydrocodone in a resin that lasts 12 hours.
Okay.
Cough syrup.
Okay, gotcha.
primary care
Hydrocodone being an opioid.
physician won't fill the prescription for Tussionex.
Right.
Trying to figure out how I can go about it without having to go to the specialist.
No, I get it. Some of my colleagues won't write anything that has an opioid in it, period.
Yep.
And there are alternatives. Right now, it used to be that if you wanted to get Mucinex DM, you had to have a prescription for it, and that is guaifenesin extended release with an extended release dextromethorphan. And dextromethorphan is an opioid analog. It is D-methorphan, whereas the L-methorphan is the one that gets, that actually has pain relieving properties.
Yep.
So dextromethorphan is the right-handed molecule of levomethorphan, but it really, unless you chug a whole bottle of it, you're not going to get high from it. But it also, apparently the cough center that is suppressed by opioids doesn't care if it's D or L. So the D-methorphan will stop you from coughing almost as well as the hydrocodone will, with fewer adverse effects and no habit-forming effects. So just go buy that, 8 years later. So we are up to June of 2015. We are going to
get them done.
Get them all done. I promise you that. Before we go, Dr. Scott, you got anything from the Fluid family?
I do. We just got one in from Terry. He's got a question about
the Bood Master.
He is the Bood Master, yes.
I wonder if he's the master in the boudoir.
The boudoir. That's pretty lame. That's a negative bill for you.
You get nothing.
All right, here we go. I've got an edible that has just...
Get your hand off my penis!
Whatever.
I've got an edible that has just 5 milligrams of THC.
Good.
And it has 80 milligrams of caffeine and a bunch of other stuff.
What?
Brain goodies. And my wife said she can smell marijuana. So it's 5 milligrams of THC and CBD combined. So... let's just say there's maybe
is it 5 of each?
Well, no, it looks like they're combined, so it's just 5 milligrams. So this 2.5 milligrams of marijuana and 2.5.
Maybe,
or
it could be
1 and 4.
It could be 4 and 1. Right. Yeah.
So anyway, the max of 5 milligrams of marijuana, the Colorado
THC,
or THC, yeah, but in Colorado, California, they say 10 milligrams. That's
pretty much
normal
everybody.
adult dose. That's kind of how they established it.
Yeah, Virginia, the most you can buy in a single vehicle is 10 milligrams.
Gotcha. Yeah. So he's saying, is it odd that my wife says she can smell the marijuana on me?
Okay, so I'll tell you what this is. This is a gummy that was made from extracted marijuana plants, cannabis plants. So no, it's not that odd.
No, it's not.
And yes, you can smell it, you can taste it. When it's synthesized in the lab, it's a little bit different because you don't get all the other aromatics that go along with it. If you just get pure THC or pure CBD. But you can tell the ones that are synthesized in the lab versus, which is like Marinol, Dronabinol, they sell it as, but it's THC, versus stuff that's extracted from a plant.
Right.
And that's what makes Marinol legal because they can sell it in a known milligram quantity with a known purity. And that's the only way that FDA can approve things. They can't approve things extracted from plants, so the FDA will never be able to approve marijuana as medication. Now, the federal government could just legalize it. It just seems to me that when you have the White House and both houses in Congress, there's all kinds of stuff you could do that you're not doing. And, of course, that's not the case right now, but that has been the case in the past. And a lot of lip service given about legalizing marijuana and legalizing other medical procedures that don't get done when you're in power. So it makes you start to wonder if maybe they just want to run on that because the other side's against it.
Wow.
We shouldn't have sides on this stuff.
No, we shouldn't. We should have
enough with the sides. Let's do getting a W for your side. How about the side be the people of this country? How about we do things on that side?
Yeah.
Because they have a side, but nobody's listening. We.
Yeah. Us. Yep.
Anyway.
We, the people.
Yep. Yeah, I hear a lot of lip service about helping the workers of this country, but I don't see a lot of it being done. But anyway, this isn't a political show. But it does piss me off about the marijuana legalization. It's been legalized already.
Makes no sense.
The dispensaries that operate in this country are operating with the hope that the federal government will not crack down on them at some point. Just decide, we're just going to do it because they can.
Yep.
The federal government doesn't recognize the state's rights to take a Schedule I drug, which is Schedule I drugs are quote unquote illegal drugs, and make it legal. Now you can make a non-scheduled drug a scheduled drug. They did that in Tennessee when they took gabapentin, which was not scheduled, and made it a Schedule 5, so now it has to be reported. Or you could make a Schedule 5 a Schedule 4 or a Schedule 2 or whatever you want to do. They're fine with you working your way up the ladder. You can't work your way down the ladder. And the federal government's just not enforcing it, but they could at any time do it. But also, if you are in a party that proclaims that you're in favor of legalizing marijuana, particularly, and you have all three parts of the legislative and the executive branch, and you don't do it, you got to ask why. So is there a reason why? And the reason is going to always be politics.
Yep.
And when you don't make a decision based on what's best for the people, what you're doing is making a decision that is political.
Right.
And that's true for patients too. If you do something that's not in the best interest of the patients, then that is a political decision. Yep. Always. So, all right. It's the end of my soapbox. Sorry.
Well, that's because you're an idiot.
Yeah, I know I am. All right. Well, thanks. Always go to Dr. Scott. Anything else from the Fluid family?
Nope.
They're probably terrified now that I'm going to go on some tirade. Check out the Fluid family, youtube.com/@weirdmedicine. Subscribe to notifications. I put out a notice on Twitter @weirdmedicine, at the Weird Medicine Facebook page, and on the Weird Medicine Reddit. It's reddit.com/r/drsteve, Dr. Steve. And, or you can get the notifications from YouTube, and you can just hang out. People just hang out. You can do super chats. We don't demand them. And we have memberships. That might be kind of fun. We could do a members only thing if we get the memberships up. To do that, people would have to gift, the 99-cent membership. So for $10, I could gift 10 memberships to people. Hell, there's probably not 10 people in the Fluid family room right now.
Only one person would have to do it.
Right, that's right. I'm not begging for it. I'm just saying you could do that. And if we get enough, we'll do something for the members only. Anyway, I hope that everyone has a great week. Thanks to everyone who's made the show happen over the years. Thanks, Dr. Scott. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.